Hi, I'm Dr. David Stoker, board-certified plastic surgeon in Los Angeles. Today we have an interesting case I'd love to share with you. Let's check it out. We have a great-looking 37-year-old mother of two here who unfortunately has gained 70 pounds and lost 70 pounds twice, once as a teenager and later during a pregnancy where she was required to be on steroids. But as you can see now, she's lost all that extra weight. She is at her ideal weight, but what really bothers her is this asymmetry between her breasts. She got a lot more fullness over here. It's at least a cup size larger on her right side. She also has a significant amount of droopiness. She has dilation of the areola. As you can see how not only is the diameter increased above the ideal for this size breast, but it's kind of a dome-shaped areola with herniation of breast tissue underneath. We're going to improve all of that for her. We're going to do a breast lift on both sides, a small reduction on the right side, and then we're going to do fat grafts to both breasts. That's going to give us extra fullness up here. You might ask the question, well, why would I do any fat grafts at all on that side? We're going to do less over here, but I think it's going to be valuable to have some extra fullness up in here, just to give her a more natural shape and more fullness up here that will help us even though we're doing a lift. The incisions on the breast will be around the areola, a vertical incision and a transverse incision. Probably on this side, because there's much more extra skin than on this side, we'll need to go with a little bit longer incisions. I can't wait to get started. I think it's going to make a big difference for her. This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles.